Good morning, everybody, and welcome to this year's PPMD meeting. We're thrilled that you're here. Welcome to Duchenne 101. So the reason that we have this introduction or this session is to help everyone get to know a little bit about the disease, a little bit about who else is here, a little bit about what to expect from this meeting. So I'm going to start off with what are you going to hear and what will it mean? So this is going to be such an action-packed week that by the time you're finished with it, it's going to be a little overwhelming. So we'll just start off with what are you going to hear, what do you need to know, and what does it all mean? So I can't believe that I've been with PPMD for 19 years. I'm only 12, so I'm not sure how that happened, but many, many moons ago, when I first saw Pat or first heard her speak, she started with a story that said, you know, your life is a little bit different. Like you packed for a life that you thought was going to be on the beach. You were ready for the beach, ready for the sun, you got the sunscreen, you got the beach towels, you got the bathing suits, you're ready to roll, you're ready for the beach. You get in the car, you start rolling down the road, and unexpectedly, you ended up in a desert. You weren't ready for a desert vacation. You didn't have everything you needed for a desert vacation, but you figured out that now you're going to have to live in the desert, and now you're going to have to make the desert a little bit of your home. You're going to have to take it a little bit different approach. You're going to have to do things just slightly differently to live in the desert. So this meeting is going to be, like I said, a little overwhelming, and there's going to be a lot of things that you're going to hear, and what exactly are you going to have to decipher? So in this week, you're going to hear a lot about physical needs, We have 38 Duchenne, certified Duchenne care centers. We have over 2,000 medical providers. We are caring for, in those centers, almost 5,000 patients. So you're going to hear a lot about medical care. At this meeting, there are over 100 medical professionals here. So if you have anything that you need to ask anybody that you want to ask a question of, any burning question you've been waiting to approach somebody about, this is the place to do it. So don't hesitate to do that. You're going to hear a lot about physical therapy, about stretching, about AFOs, about night boots, about all kinds of things about physical therapy, and about equipment. So lots of things about what do I need now, what am I going to need later, what are all these pieces of equipment that I might need. So those are all caring for the skeletal muscle. In addition, we know that a lack of dystrophin in the brain can cause some cognitive issues. So you're going to hear a lot about learning issues. Every child, every patient doesn't have a learning issue, but some patients do. So if you have some learning issues or your child has some learning issues, this will be the time where you hear about those and hopefully hear some pearls about ways to mitigate those issues. Also behavior and emotional needs. I have heard over the years many, many, many parents who have said, you know, the skeletal muscle issues are significant, excuse me, but it's the behavioral issues from the steroid use that actually make our life complicated. So how do I deal with the behavioral issues? How do I give this child what he needs and still maintain some family functioning and some structure around our household that includes this child but doesn't necessarily let him get away with murder? So a lot of sessions you'll see a lot of sessions on behavior and emotional needs. So in addition to taking care of kids, we need to take care of the parents, because if mommy's not happy, nobody's happy. So we need to take care of everybody. Many moms have discovered that they're carriers. Not every mom is a carrier, but what we know now is that carriers have medical issues, and those medical issues need attention. So there's the question of what is that attention, and when does that attention need to start, and where do I go to get those medical needs met? So you'll hear a lot about carrier care, about what the elements of carrier care include and why they're important. There are many, many people at this meeting that have been to this meeting numerous times, and they've created life hacks and life pearls. So don't reinvent the wheel. James is going to talk a lot about those things, but if you hear other life hacks from other people, take notes, remember when you get home, and don't try to make it up. Try to just imitation is the highest form of flattery I've ever been told, so imitate away. Emotional care is really, really important. This is a tough disease. This is a tough disease for your child. It's a tough disease for you. It's a tough disease on your relationship. So make sure that you care for yourselves, and you'll hear a lot about how to care for each other as well. And I can't emphasize enough how important caring for each other is. So make sure you pay attention to those little pearls of wisdom as well. Everybody has an emergency, and emergencies I wish would happen in the parking lot of your Certified Duchenne Care Center, but my experience is that they happen, as Pat always says, at 5:30 at night or on a Saturday, or my experience has always been Christmas Eve. Christmas Eve is a biggie, so you're going to learn how to put a binder together, how to address the medical needs that you might have, and how to manage all of those emergencies when they do happen. Hopefully they won't, but you'll be ready if they do. There's a lot about research, days about research. There's so many clinical trials that are open right now. Not everybody qualifies for every clinical trial, and it's important that you pay attention to what you might qualify for, what your child might qualify for now, what your child might qualify for in the future. There are clinical trials that are upcoming, so those that are just about ready to open, those that are about ready to enroll, so pay attention to what's coming up, because that may affect which ones you want to join now that those clinical trials are open. So you don't always want to be, bless you, you don't always want to be included in the trials that are open if there's one coming up that you think might be better. So sadly, you have to really be a researcher yourself and know what's in the pipeline. There's bench research in process, and thank goodness, because we've cured a lot of mice, but now we're trying to cure people. So a lot of bench research that is looking at new novel therapeutics, novel approaches, upstream and downstream effects, and you'll hear all about those this week. In addition, as if that wasn't enough, we have many newly approved therapies, which is amazing. As I've said before, when I started in this field, we had steroids that we used, and PTC was on the horizon, and that was it. And to look at the agenda of newly approved therapeutics and the number of companies that are in this space right now is fairly astounding. So lots of newly approved meds. Not every med is going to be appropriate for every person, so it's going to be important that you pay attention, that you talk with your providers, that you really research and see what's appropriate for your child, what's appropriate now, what is maybe not going to hinder what you choose to do in the future. Because some of those newly approved drugs may be exclusion criteria for future trials. So you really have to pay attention to what's approved now, what might be appropriate. There are meds that are on the horizon and meds that have been used for a really, really long time. There are meds that have been out there for other reasons. They're being repurposed, so we'll have those discussions all week. Is that enough? So the most important thing I want you to remember from this meeting, if you get nothing else out of this 20-minute talk, is don't get ahead of yourself. This disease happens in stages and phases. You only really need to worry about what's happening right now with maybe a little glimmer to the near future, but don't get too far ahead of yourself. It's already overwhelming. Don't let it become even more overwhelming. And you have to remember that your future is really unknown. I mean, what was approved this week wasn't approved last month. So we have no idea what your future will look like, what your child's future will look like. So don't try to speculate, and don't go down that dark rabbit hole, because we don't even know what's on the other side. There might be rainbows and unicorns, and we have no idea. So let's hope for rainbows and unicorns and keep plugging away one step at a time. Just really slow down this week. This meeting is all archived and on the website. So you can sit and take notes, but there will not be a test. So you can take notes on what you need to take notes on, what you want to remember, but just remember that you can watch this all, even me, you can watch this all replayed at your leisure when you get home. So if you have something that you can't remember, just look up the talk and you can watch it at home and review it. Schedule breaks out of this room. This room is going to be very full. It's going to be overwhelming. You do not have to stay in here for 4 days. So in addition to your agenda and all those talks that you circled that you want to make sure that you don't miss, you need to include get out of the room for a while. And the most important places that I've found in this meeting are the pool and the bar. So, if you, I'm not encouraging drinking, but if you want to meet people and you want to talk about things that are not in this room or things that you've heard in this room that you have questions about, the pool's a great place to go. The bar is where all the excitement is happening after hours, and there are always people that you can talk to. If you have any questions, all the staff has a black lanyard, so just find somebody with this shirt today and a black lanyard, and we'll be happy to answer any question that you've got. Make yourself go play and make yourself be alone. Many of you brought your kids. Make sure you have pool time and play time with them. That's incredibly important. Don't spend your whole week in this room. So most importantly, you're going to learn to live a life that's slightly off-center from the one you expected. So we're in the desert and not the ocean. It's a little bit different, but it's still your life. As Nevin said yesterday in the Becker meeting, it's about learning, it's about doing what you can and not what you can't. So concentrate on the things that you want to do, the things your family wants to do. You may just have to make little alterations. And you're going to have to learn how to live a life that isn't all Duchenne, but a life that's filled with life, love and laughter and adventure and fun, and includes Duchenne. So you just have to work around Duchenne and include it, but not focus on it all the time. Nothing is lost without something being gained, and what you're going to gain here is important. I've learned that you have family that you choose, you have family that you're born into, and you have family that's born out of necessity. And this family is born out of necessity, but it's a family that will take ultimate care of you. So they will hold you close, they will hold you up when you need it, they will call you out when you need to be called out, they'll tell you what you need to know, and they'll tell you how you need to hear it. But it's a family that will hold you in the palm of their hand and guide you and help you on this journey. So don't ever forget that we're always around, that this is the family. When you look around this week, you can look around at your new family and appreciate that these people are all here for you, and they all want the best for you and your family. So this week, find your heroes, whoever they might be, and realize that they're often found in the most unexpected places. We're glad you're here. We're here to help you. We're here to answer any of your questions, so please feel free to reach out. On the panel, Colleen is a mom of 3 children, and Brandon is 9, and she's been to this conference many times. So she's going to help tell you about what her experience has been and what she has suggests for you and what she knows. Ready?
Good morning, everyone. Teacher voice. Yes, I am a teacher, or was a teacher. But I'm Colleen Labbadia. I live here in the Orlando area, and I am a mom of 3. My daughter, Kate, you'll see my 3 running around here. She's 15. My son, Brendan, who has Duchenne, is 13, and the baby just will be 10 in a few short months. So new to all of this, with my kids here in tow. Normally I come to conference by myself, but welcome to our family. I know this isn't the group that you probably had set out to say, hey, I'd love to join the Duchenne community, but it's such a wonderful place to be. I mean, this will become your family, will become your lifelines, will become everything that you didn't know you needed. And I mean that from the bottom of my heart. When my son was diagnosed, goodness, almost 12 years ago now, it took me about 1.5 years to come to the summer conference. I just couldn't muster the strength and the wherewithal to get here. But once I finally did, I realized that these are my people. This is where I need to be. This is going to help me through this journey, because I had no idea what I was doing, what I was in store for, and it has made all the difference in our journey. Just a couple weeks ago, my son fell while we were on vacation, and he broke his femur. And the first people I reached out to were our PPMD clinical staff. And then onto the friends who lived in that area, like, hey, I'm in Chicago, where should I take him? He has a broken femur. And it just, the support you get is amazing. And where I made these connections and where I made these friendships was here, each summer at our summer conferences. And I'm gonna be totally honest, the first 2, maybe 3 years, I sat in every single session. I had colored Post-it notes, I took notes, I wore myself out. It was, like Kathi said, it can be very, very overwhelming, but it doesn't have to be. So as a mom of somebody with Duchenne, but also a counselor, I'm going to say to you guys, please take care of yourselves. This is a lot, especially with it being your first conference. You don't have to know everything. You don't have to leave here an expert and making sure you've dotted every I and crossed every T. Pick and choose. Come to some of these sessions, learn what you can learn. But when you feel like you've had enough or you feel like you need a break, please do yourself a favor and go ahead and take that. Even if it's just sitting out in the lobby, or if you need to have a good cry and you just want to run back to your room, that's okay. If you want to go float in the lazy river, my kids have done that since we've gotten here last night. It seems very therapeutic, if I'm going to say so. Go for it. Or if you just want to meet other people or you just want to decompress, there's so many of us around. Guys, I'm a talker, so find me. We can chat. I'm also a hugger, so if you think you need a hug, come find me. But just know that taking care of yourself is such a pivotal part of this journey. And you want to be okay, so you can be okay for everybody else that you're caring for or everybody else who's here with you at the conference. I know at first I was kind of hard on myself, like, did I get everything? Did I get as much out of this conference as I could have? Did I talk to enough people? Did I ask the right questions? And the answer to all of that is yes. Yes to all of it. Just being here alone is going to be so beneficial for you and your children and your families that when you leave, you're going to be amazed at what you brought home with you. But the best part of when we depart on Sunday is you have a lifeline to everybody. You're going to make friends. You're going to share numbers and social media. You're going to have clinicians and researchers and everybody who has now become part of your extended family that you can reach out to in a heartbeat. So when you get home and when you decompress and you say, hey, I learned about this, but I missed this session, or, I just have more questions about this. Did I understand this correctly? You're going to have plenty of people to reach out to. So I hope you enjoy yourself, and that's the biggest thing. It's a huge first step to get here. It's a huge first step to immerse yourself in the Duchenne community, but also treat yourself well. And I think, Kathi, you said it great when you said make sure you play. While you're here, definitely. If you're going to work hard, make sure you play hard. And again, if you need anything, you will see me around all weekend. I'm happy to chat, happy to give you a hug, whatever you might need. I'm happy to decompress along with all of you. Okay, thank you for being here. Look forward to meeting you guys.
So you may have noticed that we have a cadre of incredible genetic counselors, and Kayla is here. She's going to talk about the Duchenne Registry, which is really, really important, and why it is really important that you all sign up for it. Right?
Okay. Raise this. Good morning, everyone. My name is Kayla Banks. I am one of the genetic counselors at PPMD, and I'm going to talk to you a little bit this morning about genetics in general. It's important to set the stage of genetics in dystrophinopathy, and then also talking about the Duchenne Registry, why it's important, and what we learned from it. I also like to start my genetics talks with a disclaimer that genetics is nuanced and complicated, and there are a lot of exceptions to rules, so a lot of this is very general, but please come talk to us to talk about your specific questions about genetics. Okay, so first and foremost, whenever we talk about Duchenne, what are we saying that is? What is Duchenne? And Duchenne and Becker are muscular dystrophies that are genetic conditions caused by changes in the gene that makes the protein dystrophin. And because of those changes, dystrophin is either not made or is made incorrectly. And without dystrophin, the muscles are not able to function or repair themselves in the correct way. This is a diagram of the muscle cell membrane, and I like to include it because it gives you a visual of what dystrophin is really doing within those muscle cells. So the big yellow chain in that diagram is dystrophin. And you can just visually see that it's important for the structure of that membrane. It supports the membrane so that the muscle cell can function correctly. It does also have some effects on signaling and transfer of ions within the membrane, so that is important as well. This is a very simplified diagram, but I include it to just demonstrate that, yes, we have changes in the DMD gene, the gene that makes dystrophin. There are a lot of different presentations that we can get just from having a change in this particular gene. So this includes Duchenne, it includes Becker, it includes people that have isolated cardiomyopathy and don't have skeletal muscle symptoms. It also includes people that have things like muscle pain, aching, but no progressive weakness. So there are a lot of different presentations that we can get within the spectrum of dystrophinopathies. And I'm sorry, I have to include a little high school biology because this also helps to set the stage. But if you remember, our bodies are made of cells, and inside our cells are structures called chromosomes, which contain our DNA. DNA is the instruction manual for our bodies. It tells us how to grow and develop and function. And it's divided into segments called genes. Each gene contains the instructions for making a particular protein. And generally, most people have 46 total chromosomes. They come in 23 pairs. We get one from each of our parents. The kind of set that I want you to key in on here are the last set. So DMD is located on the X chromosome. Most people who are assigned female at birth and develop as female have 2 X chromosomes, compared to most people who are assigned male at birth and develop as male have 1 X and 1 Y. You hear a lot about the exons of DMD, but what the heck does that mean and why does it matter? So the exon is the coding part of the gene. It's what our body actually reads to get the instructions to make dystrophin. There are intervening sequences called introns, and while they're not part of the actual instructions for making the dystrophin, they're important for how those exons come together, and so they can also play an important role in how dystrophin is being made. This is just a visual of the 79 exons of the DMD gene. They fit together like perfect little puzzle pieces, so our body can read through and make dystrophin. And you might hear some people talk about, oh, we have a variant that is very common. There are other people or a set number of people that have this particular variant. You will also hear of people who, there's maybe not people who are reported with that same exact change. And that's not that uncommon. There are over 8,000 different genetic changes that have been documented in the DMD gene, and these are just the changes that are referenced in publications and have been shared kind of widely. So there are more that just haven't been documented. Most often skipping ahead. Most often we see large deletions of 1 or more exons. We can also see duplications or smaller point variants. And whenever we talk about deletions and duplications, you'll often hear about the reading frame rule. And essentially, that's how our exons fit together so that the body can read through and make dystrophin. Whenever we have an out-of-frame deletion, essentially an exon is taken out or multiple exons are taken out, what's left on either side, it doesn't fit back together. And so the body can't read past that, and we don't get production of our dystrophin protein. That is compared to an in-frame deletion where something's taken out, but the flanking ends are still able to fit back together, and so the body can still read through and make some dystrophin. It's not the same. It may have a varying level of functionality, but we can still make some dystrophin. And this is the basis for exon skipping therapies, where we're trying to restore the reading frame for someone so that potentially we can get some production of dystrophin. This can tell us also a little bit about where we might expect someone to be on the spectrum, with an out-of-frame deletion and no production of dystrophin typically having a Duchenne presentation compared to an in-frame deletion and some production of dystrophin having a Becker presentation. We mentioned that DMD is on the X chromosome, and so it follows X-linked inheritance. So there are kind of two sides to this diagram that are important to talk about. So let's say we have an XX female who is a carrier. So she has one X chromosome that is as we expect it to be, and one X chromosome that has a DMD variant. With each pregnancy, she would have a 50% chance to pass on that variant. If we have a XY male who has Duchenne or Becker, he would pass on his X chromosome to each of his daughters. So each daughter would be a carrier. All of his sons would get his Y chromosome, and so they would not have Duchenne or Becker. Moving into a bit of a conversation about genetic testing, I think we all know this, but it's important to reiterate that genetic testing is really important. It's still the gold standard for diagnosis of Duchenne and Becker. It can tell us a bit about where we expect someone to be on the spectrum. It can tell us about what types of therapies they might qualify for based on their variant. And it can also help us with testing of other family members. So the most accurate way for us to pursue testing of family members is to do targeted testing for that specific known variant. PPMD does have a sponsored genetic testing program called Decode Duchenne. If you need access to genetic testing for Duchenne or Becker, reach out to me. I'm happy to help. Okay, moving into the registry. So the Duchenne registry is our patient report registry to learn more about individuals with Duchenne and Becker and female carriers. The registry has been active for over 15 years now, and it's a really great wealth of data for us to understand the natural history, the progression, and just learn more about everyone's experience with dystrophinopathy. The registry is on an app, which makes it nice and sleek and easy to interact with, which has been fun. In order to be active in the app, there is an, oh, I went too far. Maybe, okay. Sorry, guys. There is a pre-registration that you should complete online, essentially just entering your name and your email. Once you enter that, you will get an email from the app platform with your invitation to participate in the registry. It'll have an activation code to get into your app. There's also a Spanish version of the app if your preferred language is Spanish. So if you're interested in that, there is a link to click on that join page as well to say, hey, I would like a Spanish invitation to participate in the app, and then we can push one to you. There's an e-signature consent that you'll complete once you're in the app saying that you understand the study. And then once you complete that, you will see your activity page in the app. There are separate surveys. Each survey takes about 5 to 10 minutes to complete. You do not need to complete all of them at once, so you can kind of answer a survey whenever you have a minute, come back to it later. So, I talked about the registry, but why the heck is it important that we have participation in the registry? What do our participants gain from providing their information? So first and foremost, you can be a citizen scientist. This is a way that families are able to contribute to knowledge about dystrophinopathy. We can also get you connected to trials or approved medications that could potentially be an option for you. So whenever you provide us your information, we keep all of that. Companies will reach out to us and say, hi, we are recruiting for this specific study. This is the group of people that we're looking for. We can pull only those people from the registry and then send you an email and say, hey, there's a study that you might be interested in participating in. Here's the information and who to reach out to. This way, you're also not getting invitations for things that you wouldn't be eligible for. So it's really a targeted way to get information about things that are relevant for you. And it's just a good way for us to have a better understanding of dystrophinopathy. There's still a lot to learn, and especially with new therapies, there's a lot that's changing, and so we want to be able to track that and understand it better so that we can move forward. That was a really quick overview, but again, myself and the other genetic counselors will be around this week, so please come find us. You can also email us. We have one-on-one appointments, and also you can just reach out.
We're going to have time for questions at the end, so if you're formulating questions now, make sure you remember them. James Poysky is our last speaker, and he's married to the amazing Rachel. He has a daughter, Haley, who he would not, Hallie? I always say that wrong, sorry. Who really wanted to be a hip-hop dancer, but she's a really great soccer player instead.
No, actually she's gone into theater.
Oh, now she's in theater. So many transitions. And Joel, who I can't believe is 21. So, as we said, this is a family diagnosis, not just of one person being diagnosed. So Joel's not going to do that. James is going to talk about family dynamics.
And I've been drinking coffee all morning, and I was sitting there. I started getting nervous, and so now I'm sweating profusely. So I'm not normally this nervous. All right, so I'm going to be talking about not just living, but thriving with Duchenne. And so I wanted to give people kind of some tips and some advice based on our family's experience, as well as families that I've talked to even around the world. So we've been in this, he's 21, and he was diagnosed when he was 3. So about 18 or 17 years now. So we probably have too much experience with this. All right, but we'll dive in. So there's kind of 3 main things that I want people to be thinking about when you're thinking about things that can help you kind of navigate this whole experience. One thing is being proactive, and I'll get into that and talk about what that means. Also, the importance of self-care, and other people have already discussed the importance of that and talked about kind of some general things to keep in mind, but I'm going to be even more specific about that. And then also living life to the fullest. And I know these are all kind of things that are a little bit cliched and they're kind of vague, but they are important. So bear with me as we go through this stuff. So the first part, be proactive. Oh, and I forgot to ask, how much time do I have? Because I have a lot of slides. 55 minutes. Oh, wow. Okay, so we're like, okay. Well, you better be careful. Okay, so one thing, and I know that there may be families in here who are not newly diagnosed, but this is predominantly geared towards families who are newly diagnosed, and this is something that I get a lot of questions about, and I don't know, did you mention that I'm a psychologist also? No, I didn't. Oh, okay, so I'm a child psychologist and a neuropsychologist, and so I interact with lots of families about their concerns. And one thing that I get a lot of questions about is, should we talk with our son? And I'm using the term son predominantly, even though obviously there are other people that are affected, like a small amount of girls and that sort of thing. So bear with me. But when should we talk with our son about Duchenne? Or should we even talk to them about it? And there's a lot of reasons why people are really nervous about this. And for one thing, they don't want to cause more distress. They don't want the child to become really distraught or sad or that sort of thing. They may feel like they don't want to tell their child that because then the child will kind of limit their own dreams or aspirations or goals for the future. Sometimes people are afraid they're going to say the wrong thing and they're going to mess it up or make things worse. And oftentimes, I don't know if as parents we always want to admit this, but sometimes it's painful and it's stressful and it's difficult for us to talk about. And some families tell me, I'm afraid I'll start crying if I start talking about it. Well, those are all certainly things to think about. The problem is there are some drawbacks to not talking about Duchenne. For one thing, it can become very stressful and complicated to try to keep secrets. And usually it doesn't work. Eventually the truth is going to come out. And also, too, people are going to try to find answers on their own. And if you're leaving it up to other sources of information, such as the internet, sometimes your child will come across the wrong information or information that isn't really suited to their specific experience. In clinic, I've had families who've come in and the young man is 18, and the parents pull me aside and say, "We don't want you to say anything about Duchenne. He doesn't know that he has Duchenne." And I'm like, "Really? Are you serious?" And I've turned to the young man and said, "You know why you're here, right?" And he's like, "Oh, yeah. But there's been such a wall put up that then it becomes really awkward, and it becomes actually very difficult to talk about if you put it off too long. The other thing, too, is that silence communicates a lot of information. If we're not talking about something, we're communicating to the child that we don't trust you to be able to handle it. Or just as a family, we don't talk about difficult things, which, believe me, later on, that's going to come back to bite you. So you want to avoid that. Now, the most important reason to talk about Duchenne is that people need information to learn how to cope with difficult life situations. So I kind of give people this example. Well, what if you had some pain or something was bothering you, and you mentioned it to your physician, and your physician said, "Oh, I want you to go talk to this oncologist. I want you to do some tests." And you went in, and the oncologist did some tests and said, "Well, gosh, well, I just don't want to talk about it, but you'll be fine." I mean, that would probably be pretty stressful for you. Now, certainly it's difficult to get bad news, but at the same time, that's how you deal with it. That's how you manage that situation. That's how you get the support that you need. And kids are the same. They need information in order to be able to learn how to manage what they have. And the other thing, too, is that being a parent, the goal of parenting is not to protect your kids from everything. It's to teach them how to deal with life's difficult scenarios and difficult situations. And by communicating information to them, that's a part of that process. And so we're modeling to them how to go about doing that. After going through this type of conversation with families, often they ask me, "Well, how do I do it?" or "When should I do it?" And, they say, "What's a good time to talk with my child about Duchenne?" And it's a really cliched answer, but I always say, "Well, yesterday was a good time." The time is never right, and the time is always, you should have already been talking about it. So sorry if that's kind of insensitive or kind of a smart-ass comment, but that's the truth. Like, the sooner you start, the easier it is, and the more natural that conversation becomes. And even kids who are very young, 3-4 years of age developmentally, they are old enough to start to have some sort of understanding of disease and the disease process. And so, obviously, the words that you use are going to be geared towards the child's developmental level, and you don't necessarily have to tell them everything, but starting to give them some level of understanding at their age level is definitely a good thing, because it's also not the sort of conversation that it's once and done. You're just starting the process, and then it's an ongoing, evolving sort of thing that occurs differently over time, just depending on their age and on what's happening. The other advice that I would give to people, actually, I forgot to mention this. I'm going to go back one. How come I got the remote control to work? Anyway, I have the magic touch, I guess. Just good, I guess. I don't know. The other thing that I was going to mention, too, is that, especially with young kids, when you're talking about Duchenne, the thing that is going to have the most meaning to them is when you're talking about it in terms of their day-to-day experience, such as, this is why it's harder to keep up sometimes on the playground, or this is why we do stretching, or this is why your muscles hurt at these different times when we do these different activities. That's going to have a lot more meaning for them than if you're talking about the dystrophin protein and the connections that it makes to the dystrophin and anyway, the spots on the muscles. And that's a technical term. It's going to have much more meaning than a highly technical conversation. But as they get older, then they may want to know that information, and so that conversation will evolve over time. But you don't have to use complicated words. You do want to start to use the diagnostic terms. You want to use the term Duchenne muscular dystrophy. Even though at that young age, they're not going to know what that means. That's how you help them understand what that means. That's how they develop knowledge and understanding of those kinds of diagnostic terms. But also including some sort of more common explanation like your muscles work differently or your muscles are not as strong as other kids. You want to include that sort of description as well. So another tip that I would give you about being proactive is address any problems with learning, behavior, development. Address them early on as much as you can. Don't wait to see if your son will outgrow it. Now, I know this is tough because oftentimes, especially around the newly diagnosed phase, you're dealing with a lot, and there's a lot of medical stuff that you're trying to learn. You're trying to just process, your grief and your experience. But at the same time, if you have the bandwidth and there are some concerns about behavior learning and development, try to jump on that as soon as you can. The reason being is that the earlier you address it, the earlier you do interventions, the more benefit those are going to provide, and the easier it is to make progress. Compared to the longer a problem's been going on, it takes a lot more energy and intervention to make the same degree of progress you would when they're younger. The other thing, too, is I think this is starting to change, but especially when my son was diagnosed, there wasn't a whole lot you could do medically. You provide supportive care, you do steroids, but we didn't really have very much that could fix it, per se. However, when it comes to the behavior and learning and developmental problems that we can see, we definitely have effective interventions that can help. Now, I'm not going to oversimplify it and say that it's easy to fix necessarily, but there are a lot of things that can be done. And the same kinds of treatments that work for kids who don't have Duchenne work for kids who do have Duchenne. So don't let anybody tell you, he's a boy, he'll outgrow it. I hate when I hear that. Like, drives me crazy. Parent intuition is usually correct. If your gut's telling you that something is off with this stuff, go find somebody to check it out, go get it treated and taken care of, rather than kind of pushing it down the road when it becomes a bigger hill to climb. The other important thing, the other kind of third area to thrive in Duchenne is self-care. Now, people have already mentioned this before, and it is really important. And I think, I think I'm thinking of it more in a general sense, not just kind of managing yourself here at the conference, which is it's like a fire hose, drinking from a fire hose. It's a lot of information you get hit with, and you have to make sure you take care of yourself in this context. But I'm thinking more over the course of the next 40, 50 years. It's really important that you take care of yourself for a couple of reasons. One is so that you can continue to provide the care that you need to for your child who has Duchenne. But also, kids watch us and they learn from us. And the way that we can help them learn how to deal with their emotional distress or to be well-balanced emotionally is for us to show that we're doing things to take care of that in ourselves. It's really important because, not surprisingly, we can see where there's definitely increased risks of anxiety, depression, stress, like chronic stress that we can see when in parents of kids who have Duchenne. So it's pretty common. I mean, and it can really, caregiver burnout is definitely a real thing. And we can also see, too, where, this kind of goes back to what I mentioned before, but a parent's emotional adjustment is heavily influenced by their child's emotional adjustment, which kind of speaks to an important way of taking care of yourself is making sure that you're being proactive about addressing a child's behavioral or developmental or emotional needs, because it actually does then help you be better adjusted yourself. It's also the sort of thing, too, where it's not the sort of situation where, as parents, we can just kind of adjust and learn to cope with it, and then we can kind of move on with our lives. It really kind of more goes through phases, where we go through kind of intense episodes of distress and grief, and then we can kind of adjust. We can kind of mentally, I mean this in a good way, kind of compartmentalize it and maybe, not have it right at the forefront of our mind. But then something will happen that pulls everything up again. Maybe it's a change in milestone. Maybe we move from ambulatory to needing a wheelchair, or something happens on the playground that reminds us of the situation that we're in, and it all comes kind of rushing back. That's a normal part of the process. But that can make it difficult, and it really does also emphasize the importance of taking care of yourself as a care provider. Oh, now it's not working for me. There we go. Okay. An important part of self-care is getting emotional support. I think one of the biggest benefits of having a conference like this isn't just to get kind of cutting-edge information, it's to connect with other families. You have to be intentional about that, though. Oftentimes, I think especially as a parent with someone who has Duchenne, it gets more and more difficult to sometimes stay active and to develop the same friendships that you would in a different phase of life because of the complication related to the Duchenne. Like, it's a lot more work to get out and do stuff. Oftentimes you're more tired, or, sometimes you just kind of want to be alone. It is important to be more intentional about nurturing your own relationships, your own friendships with people. It's also important, too, to be part of a community like this where people understand your experience. Nobody quite gets it like other parents who have Duchenne, and that's important. It's also important, too, to not be afraid to ask others for help. I've got no problem with that. People probably get annoyed with me for, doing that sort of thing. But some people are really reluctant to do that. They don't want to burden other people. But honestly, most of the time, people are there to want to help you. They want to support you, but they don't know how. And so communicating that to them is, and tapping into that resource of friendships and relationships that you have is really important. The third thing is, when it comes to social support, is get involved with something when it comes to Duchenne. Not expecting everyone to fix everything, but do something because it will make you feel better about it. It gives you a sense of agency. It gives you a sense that you're not just kind of the victim and that you can't do anything and everything is against you. Being involved is really important, and there's different ways to do that. PPMD, I think, is excellent at being able to plug people in, but you got to put yourself out there. At the same time, realize that this is not a sprint, it's a marathon, and so you have to pace yourself to be able to hang in there and keep doing this for 30, 40, 50 years. So I see sometimes, I call it the 3 years and out sort of thing. There's some families that come in and they are going to change the world. Like, they are doing everything. They're like full steam ahead, and they're involved with everything. They're trying to fix everything. In about 3 years, they kind of burn out and fade off. Don't be that family. But also don't be the family that kind of shuts himself away and kind of drops off the face of the earth and isn't involved with anything. Like, finding that balance, finding that happy medium is really important. But it really does help you cope with the whole situation. The other thing is, and this is a little bit more specific, to the moms out there, make sure that you take time for yourself. Don't be afraid to say to your child with Duchenne, I can't do something for you because I'm going to go out with my lady friends, right? There's times at our house where we will lock the door so our son with Duchenne cannot bother us about something because we just need a few minutes away. You have to be able to set some boundaries and don't feel like you have to do everything. The other thing is, at our house, we just focus on being a good enough parent, which, sometimes that's a little bit sketchy as far as kind of what that means. But the point is, you don't have to be the perfect parent, and you don't have to meet every need of your son. The other thing, too, is it's important to push your son out of his comfort zone. It's okay to say, you need to try to do that for yourself, even if it would be a lot faster, easier, and show more love if you did it for him. But again, that helps set the boundary so you have some space for yourself, but also helps promote independence in your son. As far as dads go, it's important to develop a hobby. Do something, golf, I don't know, I hate golf, but some people like it for whatever reason. Have a hobby where you can get out of the house and have your own time and do something that can burn off some energy. Once a year, I like to go to Montana. I go by myself. I go backpacking in the backcountry. I wear a gun. I feel very manly. I take a lot of Advil, so that kind of undermines that previous statement. But do something that recharges your batteries. The other thing, too, is fathers, it's important to realize that, and I think this is changing, so maybe I'm making too much of this, but this isn't the sort of scenario where mom does the kid stuff, dad does the work stuff. It can't be like that. You have to be available to provide more support to the mother in situations where maybe you otherwise wouldn't have. So going to doctor's appointments, Be there, even if you don't know what's going on or you don't know what they're talking about. Just being present and being there is important, even if you have to take time off work to be able to do that. Be more available to take over child rearing stuff so mom can go take a break for herself. It can't just be necessarily kind of traditional gender roles in the way that it has been in the past. Oh, and the last thing too is anybody who feels like they're starting to get burned out, starting to get depressed, the level of anxiety is really high, don't be afraid to seek help. Again, it's better to be proactive and to seek help even if you don't need it than to put it off, and then you're in a deep hole that's hard to dig out of. The other thing is just in terms of kind of general philosophy of life, don't let DMD be the thing that defines you, right? DMD is a part of life, but it shouldn't be the thing that defines you. And also, too, just as a general parent approach and philosophy to life, remember that your kids watch you. And if you are bitter and resentful and unhappy about everything because of Duchenne, your kid's going to see that. And that makes it hard for them to then also learn how to cope with Duchenne themselves. So try something to be positive about. That's really hard for me. I'm a natural cynic. It's like, swimming upstream. But it is really important. Social media, I have to mention, I tend to actually not be a fan of social media. I think can potentially be very toxic. So be careful about social media. Now, a lot of people can find it as a way to get emotional support, to get advice, that sort of thing. So I don't want to be totally dismissive of it, but be careful because it definitely can also be very toxic. There's studies that have come out that show that negative messages are forwarded and liked 1,000 times more than positive ones. So there's definitely a trend. And it's also, too, when people post online, they tend to post all the good stuff and not necessarily all the struggles they're going through, and so it makes it feel like you're the only one who's experiencing the difficult stuff. And this kind of actually, I put this, I don't know how this picture was taken. This is like the antithesis of everything that I am, because there's like a rainbow, and it's like this posed picture, and I'm kind of smiling. That's not me. I tend to be very cynical and negative about things, just kind of as a natural characteristic. So, but the point is, it is important to try to look for the positive in Duchenne. There's some research, and actually Ms. Kathi Kinnett was involved with this. There's some research that shows that one of the things that helps people cope with a difficult situation like Duchenne is actually being able to identify some silver linings. As kind of paradoxical as that sounds, if you can identify some positive benefit that has come out of this experience or that is happening as a result of this experience, it makes it a lot more easy to manage the difficult components of it. So, for example, our family, we've made some of the best friends that we've ever developed as a part of being involved in the Duchenne community. If our son wouldn't have had Duchenne, we would have never met these people and had these opportunities. So I know it sounds weird, but if you can identify some positive aspect of it, it really does help. Also, saying positive things to yourself. I know, again, it sounds cheesy and cliched, but it really does make a difference. And saying, rather than, I can't deal with this is going to be terrible, saying, you know what, this is going to be tough, but I can handle it. I've gotten through things like this before. We're going to be okay. Little things like that really make a big difference. The other thing is looking for, we have kind of a morbid sense of humor in our family, and looking for things that are funny that other people might not appreciate, it's important. Again, other people aren't going to get it, but that helps make light of a difficult situation, and I think my son's not in here, so I can share this. In Texas, it's really hard to get on Medicaid because there's lots of means testing, and it's really hard to qualify for the non-mean tested Medicaid. And so one time we had the social workers. Oh yeah, my wife's back there. She can tell you this story. But we had social workers who came to our house, and it was looking like he was not going to qualify, right? Because they go through an interview and they ask you different questions about what kind of help does he need and what are his problems. And we weren't thinking that he was going to qualify. But at a certain point, he decided he had to go to the bathroom. This is when he was I think 8 or 9. He went back to the bathroom, and he was able to go to the bathroom by himself. He didn't need any help. But that day, he suddenly decided that he needed help with wiping. He didn't need that help, right? But he was back there and he was shouting out of the bathroom, "Come wipe my butt, come wipe my butt." And like the social worker, their ears popped up and they started scribbling furiously. And we were like, "Oh yeah, he needs help with the bathroom," because that's apparently one of the qualifying things we didn't realize that could get. Anyway, afterwards, we were laughing so hard, we were crying. And nobody else would have appreciated that aside from, other families who have Duchenne. But you have to look for kind of things to laugh about, and you have to sometimes have kind of a little bit of a sick sense of humor, and that's okay. Now, when it comes to self-care, relationships can really take a hit from Duchenne. Like Duchenne, if there's any sort of weakness in your relationship, it will magnify that, and it will, really blow it out of proportion. One of the biggest things that we run across is differences in expectations among people in a relationship. So people experience grief in different ways. Some people, they want to just kind of tune out and go into the fetal position. Other people, they want to learn everything about it. Other people, they want to fix the world. Other people just fall apart. There's no wrong way to experience grief. Like, everybody is different, but sometimes people experience it in different ways, and that can make it feel like you're alienated from each other. So it's really important to communicate to your partner what you're experiencing, how you're experiencing it, and to allow the other person some grace in that. And also be overt about what it is that you might need. You can't expect that the other person's just going to know what you're experiencing and read your mind. So sometimes you have to come right out and say it. It's also important to make sure that you take time aside. Have date nights. Do things together that are going to nurture your relationship. Because again, you need that solid foundation in order to continue to provide, kind of the best environment for your son and the best care for your son. It can be really easy to kind of attack each other based on, differences of opinion or the challenges that it comes to caring with somebody who has Duchenne. So realize that it's not each other that's the enemy. You're on the same team, and you're stronger working together. And it's okay to have disagreements, obviously. That's going to happen. But in having those disagreements, try to make sure that the main point of the disagreement isn't to win, but it's to find a solution, which is different. I already kind of talked about this before, so I'm going to skip through that. One last thing I would mention, though, is that when our son was first diagnosed, I think one of the most helpful things that we did at that point was we came up with a list of goals. I can't remember what they are now, but we had some short-term goals for like what things we were going to do in the next year or so, and then we had some long-term goals which were kind of less, the timeline was less clear. It was kind of more vague. But I think it really is helpful to have something to work towards. And we made a point of some of those goals being maybe related to Duchenne, but some of those goals not being related to Duchenne, like purposefully, things we were going to do or things that we wanted to achieve despite it. So I think it's really helpful to have a target rather than kind of feeling like you're just kind of meandering and dealing with the day-to-day stuff. I think it gives you that longer-term view, which is helpful. All right. I still got time, man. Okay. This worked out well because I thought it was going to be going way over time. All right. The last tip or life hack, I don't know the right way to phrase it, but the last thing to be thinking about in terms of thriving with Duchenne is it's really important to try to push your child to be as independent as possible right from the start of diagnosis. You have to push them out of their comfort zone. You have to also make sure that you are having, positive expectations for the future. Realistic, but also positive. You also want to push yourself out of your comfort zone. So I know, for example, I spoke with a family a few years ago. This child, he'd had difficulty developing some friendships, but he has started to develop some, and these other kids wanted to have a sleepover, and they had invited him over. The parents felt really nervous about that. They felt like the child was going to fall and break a leg, and really wanted to kind of keep him at home. And he was still ambulatory at this point. He could get around okay, but really wanted to keep him home out of fear of kind of like the worst case scenario that could happen. But you can't live like that. You have to let them be their own person, and obviously we want to make sure that things are safe, but you can't bubble wrap them. And so that means sometimes pushing yourself out of your own comfort zone as far as what you're letting them do or trying to promote them to do. my son has some social anxiety, and he was terrified in the middle of this cheerleader, in the middle of this group of cheerleaders. But afterwards, like, his smile was so big, like, we couldn't get him to stop smiling for like 3 days. So anyway, there was a project done looking at independence by Janet Hoskin. She's a psychologist in the UK. She also has a son who has Duchenne. And she looked at what are the things that need to be in place in order to help kind of maximize people with Duchenne being independent when they're older. And she found, excuse me, kind of 4 main things. One important thing was, it was really important to find older role models of people who have Duchenne who are successful. So they're living as independent as possible. Maybe they're even married and they have kids, they've got a job. Like, it's really important to find people like that to connect to when you're younger, in order to help give you that positive role modeling. And I think the PAC and some of the events that they have, I think they've done an awesome job about that. So, that's just something to kind of keep in mind as a parent to help promote that. And that's also related to the importance of being involved in the Duchenne community. It's kind of the second one. The third one was, an important part was, and this came predominantly from the young people themselves with Duchenne, but parents have to be willing to let go. And also everybody talked about kind of the importance of trying to view life as, or trying to live as normal a life as possible. And again, that goes back to making sure that Duchenne doesn't kind of rule everything. Duchenne doesn't define your whole life. I'm going to kind of skip over this because we kind of already covered that. Kind of already talked about this as well, so we're going to skip through that. So the final thoughts are, this is a little bit cliched. My son, he went and met Journey. He likes classic 80s rock. I did a good job with something anyway. So he went and met Journey. And so, again, to use a cliche, don't stop believing, enjoy the journey. But Duchenne will challenge you like nothing else, but it can also bring opportunities for good experiences that you would have never otherwise had. So I'll just leave it at that. All right. All done? Yep. That's it.
So I just realized I forgot to introduce myself. I'm Kathi Kinnett. I'm a nurse practitioner. I work with PPMD. As I said, I've been here for 19 years, and currently I'm a consultant for the care team. So I have a slightly different perspective than the rest of the panels, which is great. This is the question and answer part of the program. So there's mics around that we'd love. I hate a quiet room. So if you've got questions, please ask them. Otherwise, I'm going to be forced to try to read the questions that I wrote on here, and now I don't have my glasses. So if anybody has questions, please jump up. I'll get us started. Yesterday, when we had the new parents or the new attendees, one of the questions was, we want to do something. We want to do something to get involved. We want to do something to help our son. So how do we get involved with PPMD, and how do we get involved with Duchenne? So I'm sure each of you have a different perspective on that. So, James, you've got a mic on. You want to start?
Yes, okay. So I think a few different things. One thing that we did when when our son was first diagnosed, and which we continue to do to varying degrees, is we try to, if not already there, we try to kind of create a local community of families that we can all get together. And my wife, actually, I say we, but it's really my wife. And so she basically became a local, I can't remember what they call it, Kinnett coordinator, thank you. And so we plan different events. Twice a year we plan social events where local families can get together and hang out. And every once in a while we'll have maybe kind of like a PT come and talk about something, but often it's just hang out. It's low pressure, it's just a social event in order to really, reinforce those local connections. Now, that's a lot of responsibility, but that's one way that people could do that. We also planned and became a part of some local fundraising events. Rachel's brother Brad Todd, he's not here, but he has a lot of connections. He does PR for politicians, but also for different sports organizations, and he actually agreed to have the college, or the American Football Coaches Association, have PPMD as one of their main sponsors, and so we use that as a platform to do some local fundraising events, as well as some national fundraising events too. So I think it's about deciding what you have capacity for and what you can do, what you can sustain. I do, like I said before, it's important not to burn out, but it's important to get involved. So, you know, sometimes gauging that and early on becoming, you know, having a lot of different things going on is good, but realizing that sometimes you scale that back when you find what works for you and what's easiest. You kind of parse those things out. But I think deciding what you can handle, deciding what you have kind of a local network to support you in, and then if you're not sure, talking to other families about ideas that they've done. I think that's also a really good way.
Thanks. There are Kinnett coordinators that are scattered across the country. So the Kinnett coordinators are families that have decided, people that have decided that they will organize activities and local families to sort of give a smaller group feel to this giant national disease. So, and Colleen, you're a Kinnett coordinator, right? So, do you have a mic? So what have you done to stay involved in Duchenne?
Oh goodness, all the things. Well, when Brendan was first, when Brendan was first diagnosed, I jumped right in to try to find the best doctors. That was how I felt like I could give him what I was lacking. And it took a lot, and we saw different doctors and eventually found the greatest fit that we could. And it's not the same fit for everybody, and that's okay. So if everybody might be telling you, oh, this doctor's great, go there, maybe it's too far from your home, or maybe it's just not a good fit with the individual, and that's okay. So that was the first thing we dived into. And actually, I piggybacked off of the Poyskys and started some just little fundraising things around our community, educating everybody about Duchenne and raising money for PPMD. And I felt selfish, but it made me feel really good that I was somehow contributing. And that has just blown up over the years. We've done things with Coach to Cure as well, but we do a huge kickball tournament every single spring, and it's just been amazing. But I will say one of the best things that I have done is advocacy work for PPMD. Every February, March, we head up to DC and we go on Capitol Hill. We talk to our lawmakers, our representatives. This past year, for the first time, my son came with me. He's 13 years old. He loves American history, and he was there, and in his cute little suit, he rolled around Capitol Hill, and we got to meet one of our senators. He came into our meeting, which was amazing. I think he's going to expect that all the time now. There's going to be great people there. But what an awesome thing for us to share. Every year he's seen me come home just glowing that we're able to contribute in some way. As I alluded to earlier, we're family. We're in this together. We're going to help one another however we can. And by giving our voice and helping, whether it's get more funds for research or just get new lawmakers on board and educate them about Duchenne, it's huge. And I love now that we can do that together. It's something that now it's our thing rather than my thing. It's our thing. So it's huge. And I highly recommend it. So if you want to chat later, we can chat about that too.
PPMD also has a run program. I think the last time I ran, someone was chasing me, and I finally just said, whatever you want. But they do have a run program. My favorite run is the 0.1K, where you just run down a driveway and then it's over. So, but there are also other programs for people that actually want to run. So if you're an athletic person or a really good cheerleader like me, that's all an avenue as well. James, you talked about the importance of telling people about their diagnosis, and we have resources at PPMD to do that. Kayla, do you want to talk a little bit about what those resources are?
Sure. So there are some resources on the website that specifically talk about ways to approach talking to your child about their diagnosis. And it is different for every kiddo, because every kiddo is different, right? There are books that you can buy that talk in general terms about Duchenne and what it means. And I've also found it very helpful just to tell people to connect with other families. That's also just a great tie-in of how did you start this conversation, and at what age, and kind of how that moved forward for you, and then kind of adjust from that point to your specific child and how that best works for them?
And if I could just add to that too, yeah, I mean, PPMD has a lot of excellent resources. One thing too that we realized is sometimes it's good to have that conversation with people beyond just the child who has Duchenne. So our daughter, 16-year-old daughter, she basically let us know that she had no clue what was going to happen with Duchenne. She didn't know anything about it. And we realized we had never actually directly talked with her about it. I mean, she was there during plenty of conversations, and we're always bringing it up or talking about this, talking about that. And we thought, I guess it was just kind of sinking in through osmosis, which apparently it hadn't been. But I think as a family, and sometimes including other people like grandparents, uncles, cousins, to a certain sense, also having those conversations with teachers, sometimes with the child's same age peers, so they can make sure that they're looking out for that kid and they're being inclusive of that child. So yeah, I think that's just in a general sense, it's a good philosophy to try to promote that.
So there are resources on the PPMD website. There are videos, there are books, there are suggestions for classroom demonstrations, there are suggestions for how to talk to siblings. And at this meeting, we have the sibling breakouts in the kids' room, I believe. So if you have siblings that are here, a really good place to send them would be to the siblings, the sibling group, so that they have an opportunity to talk to other sibs, because they're going through something that nobody else is ever going to understand that isn't in this space. So just having the opportunity to talk to other people who are navigating a journey that's similar to theirs is really important. So I hear from other parents, from many parents, that it's really hard to bring somebody into my home to help with my kids, but I'm getting tired. I can't imagine how hard that is, and it's really hard to bring equipment into my home because that signals a big emotional change as well. Could you guys maybe talk about that just a little bit? That was a hard one. Sorry. Okay.
We are kind of at a new stage of Duchenne, and my son, up until he broke his femur, was very independent, and he was still getting himself dressed and in and out of bed, and that has changed just a few weeks ago when he did break his femur. And it has given us a glimpse of what is to come, which is a little bit scary. But we were very proactive in things where we didn't wait until he needed things. We kind of got ahead of the game. Like when it came to an adjustable bed, we ordered that. Just a tip of the trade, if you've met your deductible with insurance, it's a good time to order things. I learned it. It took me a long time, but I learned it. We did that. We got the cough assist machine, and even though he hasn't used it, he's trained and he's ready to use it. But it has initiated discussions between my husband and I, because Chris is stronger than me, and he does a lot of the heavy lifting, but I know that's going to catch up with him. And having those discussions with our son about, hey, Dad can't do everything, you have to trust Mom too, and maybe that means bringing somebody else in and helping you out, because it takes a village. Duchenne truly takes a village, the good, the bad, and it's okay to ask for help. It's okay to recognize you need that, and I know for us, just like James was saying, however we present it or however we lock into it or believe in it, our children are going to follow our lead. And I think that's really important too. So as hard as it may be, we can make it the best it possibly can be.
Yeah, and I would just add to that too, I mean that it is difficult because things like that, well, they represent that you're kind of having to relinquish some degree of control maybe over the situation, and not to get all analytic about it. But that's tough, right? Because that also is a marker too. That's like a progression marker. And so it kind of dredges up those feelings of, grief or distress, kind of like I'd mentioned before. However, I think to a certain extent though, the way that I've looked at it is, like, bringing those things in actually make life easier. They make life easier for the person who has Duchenne, make life easier for me. And so, I tend to like easy things. I don't know, but I think again, it's focusing on how can this benefit us? How can this make our life better? Even if it does kind of represent things that I don't like in a general sense.
Just a question. If you guys have questions, please go to the mic. That would be really helpful.
Yeah, I feel like we're just talking with each other. And, we're having a great conversation up here.
I have the subject has come up about, is there a question? Yeah. Oh, hi. You're under the light. Please ask your question.
Hello. This might be maybe for any of you or maybe James, but navigating tough emotions. I have 2 sons, 2 and 5. My 5-year-old had just received a levatus, so he's on a crazy amount of steroids. He's starting to taper down right now, but some of the times it's just like you can't necessarily get a positive emotion, or when he gets super ramped up, trying to calm him down can be extremely difficult. And then, like, sometimes I ask him, it's like, what answer are you looking for? Because I tell him the answer that is legitimate, and then I tell him the answer that he might be looking for. And then, James, you mentioned, is like, don't let him just be, he's just a boy. This is his age. What is this being the actual prednisone? What is this him being the age? And so I guess kind of navigating that type of emotions.
Yeah, no, I mean, if I had an answer for you, I'd be famous. But no, I mean, those are really good questions. And, I think that, I think to some extent, some of that stuff is probably going to be addressed, I think, is it tomorrow, or I don't think it's later today. Kathi, do you know when they're doing like the younger kids track? Or is it tomorrow? Okay. That's going to be one of the primary topics of discussion during that time, because it is such a common thing. Now, I think what I would say is, in any given situation where a kid is falling apart, you can never divvy it up and say that it's exactly 30% steroids, 40% Duchenne, 20% just kind of being a kid. Like, you can't know that stuff. All you can realize is that in a broad sense, there's probably multiple factors that are going on that are influencing that situation. And I think as time goes on, you get better at determining, okay, this is a situation I can influence. This is a situation where the rocket has launched and we just have to wait for it to kind of come back down to earth at some point. I would say that, in my experience, the things that tend to cause kind of the biggest issue are like the first 6 months of high-dose steroids. I find oftentimes after the first 6 months, things do start to kind of mellow out a little bit. The other issue is a lot of kids, and I think steroids indirectly play a role in this, a lot of kids are very sensitive to drops in blood sugar. And so if they've gone too long without eating, then they get hangry, right? And with either one of those things, if they reach the point, if either of those things are going on, there's nothing you can do to bring it down. Like, you have to, the main goal is not doing things that are going to make it worse. I think that's really kind of the best advice I can give you. Now, in other situations, maybe there's something else going on, like something happened on the playground that we don't know about, or something happened that frustrated them, and the meltdown is not about the moment, it's about what happened earlier in the day or something like that. I think a lot of kids with Duchenne, they have a hard time verbalizing what it was that happened. As they get older, they do get better at that. But sometimes just validating the frustration, the anger, the distress, that's all you can do, because there's no specific solution for it. But validating how they're feeling and basically providing emotional support as best you can, that's really kind of all you can do. Does that kind of make sense? Okay. But it's tough. I mean, there's no simple formula that once you get it figured out, then you put it on autopilot. I mean, it's not like that. And it can be a challenge. It's like 1,000 little paper cuts, that just kind of grind you down. So, yeah, sorry, I can't give you like an easy, one-shot answer sort of thing.
Yes, this is probably for Jason. What do you recommend as far as finding good counseling for whether it be the DMD boy or girl, parents, grandparents, whoever, siblings? as our journey has went, we have found that just because you start with one doctor does not mean that is your doctor. So I'm trying to cut through some of the red tape. And how do you find a good counselor?
Yeah, and you said good counselor, right? Is that?
Yeah.
Okay, sorry, it's reverberating a little
Sorry.
bit, so it's a little hard to hear. And I'm old too, so.
Welcome to the world.
You know, it's in general, it's hard to find somebody who's familiar with Duchenne. If you can, like, that's a gold mine. But that's pretty hard. And so I think really there's two other things to factor in. One is, does the counselor at least have experience with kids who have complex medical conditions, maybe neurological conditions or other things? Do they have at least some experience with that? But even more important, I think, is the counselor willing to learn? Are they willing to be educated by you about what Duchenne is and what it means? Are they willing to contact other professionals to find out, okay, I'm seeing this patient, you seem to be familiar with this kind of thing, can you help, teach me about what I can do and what should be known? Those are really kind of I think the two main things. The third thing is personality fit is really important. Some people just connect better with others. That can be tough to find. It's kind of a trial and error thing. The last thing I think to keep in mind is that in general, depending on the age of the child, there's some things that work better when you're training the parents how to be the therapist at home versus, going to meet with a counselor and expecting that to then translate to other situations. So it depends on kind of what's going on too. So if a child is say you have a young child who's having behavior problems, it's usually more helpful to train the parents how to manage behavior at home. If you have like a sibling of someone who has Duchenne who is maybe experiencing distress about that, or they're depressed because, the parents are spending 90% of their time parenting the kid with Duchenne, well, then that might be a different approach where they can meet one-on-one with them and learn some coping strategies. So it's a long, rambling answer to a short question, but there's kind of different factors to keep in mind, I guess.
I'll jump in there too and answer that. As a counselor, everyone in my house, including myself, goes to counseling. And I've just made it a very open and honest and real thing in our house, which has been so great. And it has been trial and error because, somebody that my daughter loves might not be somebody that is a good fit with my son. And a few years ago, one of the Duchenne organizations out in California, Walking Strong, hired a woman who was very well versed in Duchenne and gave 5 free sessions for family members and people living with Duchenne. And that was amazing. It was the first time ever any of us had talked to anybody who knew Duchenne. So I echo what James says. It's wonderful for somebody who is well-versed, but if they don't know, if they are willing to take the time and to work through it and learn about the disease and how they can best help you and your family, that's going to be highly beneficial. And my son, the first time he went, he was very young, and he wouldn't even look at the counselor in the eye. But they brought him into a play therapy room, and there was a sand tray there, and boy, he told them everything and then some, which I was like, I'm not sure that's true, but okay. But to James' point, we've also had family sessions where they can say, here's what we've been working on. Brendan doesn't like it when you do this. He would prefer if maybe you said this instead. And it was very eye-opening because maybe I just assumed he liked things or appreciated the way my husband and I did things. So to hear differently was huge. And I think bringing us all together in that was amazing. And I know counseling can be costly, but I will say this. If you live by a college or university, it would be ideal to look into their counseling programs. I graduated from the University of Central Florida with my master's in counseling, and I had clinical hours I had to do. So we offered free services there at the college, and my kids went through that as well. After I was a graduate, and many years later, I took them there. They had a play therapy room. They had an art therapy room. They did a lot of different things and really enjoyed it. So again, lots of schools, it's either low cost or free of charge, but I would highly recommend checking that out as well.
So that sort of feeds into the question or the topic of sometimes you're going to be the expert in the room, especially with counselors and medical personnel. So how do you deal with that?
I can answer that recently when my son broke his femur. We live here in Orlando, but we were visiting my sister in the Chicago area. And his medical team was not there. And of course, by the time we realized he needed medical attention and got to the ER and then got back to a room, now it's the middle of the night. So you can't reach doctors. I was texting everybody, but it falls on you. The biggest thing I will say is be prepared for that. And I know there's going to be a binder session later or this entire weekend. I would highly, highly recommend putting that together, because I was fortunate enough to have my husband there where we could both piggyback and say, hey, you need to look out for fatty embolism syndrome. He can't have inhaled anesthesia. But also it was a very emotional time. And although my husband and I work really well together and can piggyback off of one another, he was in an emotional state because he was carrying Brendan when they fell, which is what broke the femur. So I felt like I had to up my game and I had to be ready and I had to know all the information. And it does come with some pressure, but being prepared and having that binder or having the app from PPMD on your phone with all of the emergency steps and things of that nature is such a critical tool that I cannot express to each of you to go ahead and be ready for that. Because as Kathi said, it's gonna happen on Christmas Eve or in the middle of the night when you least expect it, unfortunately, so.
Question?
When we were diagnosed, which was like 2 months ago, we were referred actually to the PPMD website. Like every provider was like, you need to go here. And we had a phone call within like a week or so, and we spoke about the registry. And I think Kayla, what you said was that it helps fund or push for research, or like it's a good database for researchers. But why is there not a pathway right now for like an automatic like reporting of diagnoses? Just because I think if we know like what deletions or mutations are out there, like maybe that might help push like clinical research towards those areas versus like relying on people to register, if that makes sense.
I'm trying to see if I understand the question. Can you like repeat and step a little bit closer?
Oh,
I
yes.
think it's just a little hard to hear with the...
Oh, no problem. So when we had our call with PPMD, they said there's this registry that you should sign up for because that's where researchers go to look for potential participants. But I wanted to know why there's not a pathway in place for if your pediatrician diagnoses you or your neuromuscular specialist diagnoses you, that's not automatically like reported in a non-identifiable way in terms of saying, hey, like we have X number of people who are affected. And I've talked to you about this, I think yesterday in our like group meetings, that like what my son has, like he's not eligible for any clinical trials. Like no one's even looking at the beginning of the deletions. And so I just wanted to know like what can we do to maybe if there's more numbers to say, okay, this is a group worth looking at.
I think that's a fair question, but I don't have a great answer to it, to just be honest. Some of the genetic testing laboratories will kind of keep their records of specific variants that they see on reports. Some of them will share that information or try to share that information with online databases so that we can have a record, but it doesn't always happen. And it doesn't always happen in the most informative way as well. So those databases can tell us, oh, we have someone with this variant, but it doesn't give a lot of detail about what that specific person's symptoms looked like, what their onset looked like, what anything else about that person and how that variant kind of reacts, I guess, for a lack of a better term. And so that's why we kind of have to push to put together information that families are providing, because you know your kid best, right? You know what's going on. And so if we can use that so that then researchers can request data from the registry and we say, yes, we have this information that's provided directly from families talking about their experience, that's going to be a lot more impactful than those generic online databases that don't give us a lot of detail about anything. And genetic testing laboratories are kind of weird about details that they share anyways, so it's kind of difficult to get them to come together to provide all of that data to each other.
Thank you.
Also, I think because it's not a database, it's a patient-reported registry, so a database would be very vague information that would present just factual information rather than the subjective information that you're able, as Kayla said, to input about your child, that would give more specific information about that deletion and how that deletion's affecting your child and your family. That helps. All right, we're at the end of our time. So thank you. I want to thank the panel very much. It was a great introduction, I think, to Duchenne 101. And if you have any questions, again, we're here all week. So be sure you ask us whatever you need to ask us, and we'll point you in the right direction. The next session is a lunch session. So if you are interested in the subspecialty meetings that have happened this year around cardiology and endocrine and the summit, which is the professional meeting for all professionals, grab your lunch and come on back in, and we'll regroup at 12:15. Thanks so much.